Providing consistent, continuous care for a baby is a demanding task. And anyone that suggests that it is a walk in the park is clearly misrepresenting the truth. The question most mums ask is, am I a good enough mother? How can I be the best there is? And so the first thing we want to say is, there is no such thing as the best mom. And we are constantly bombarded by expectations, whether it is from friends, families, social media, our very own expectation of what it is that I need to do to be the very best, to give my baby the very best start in life. The best that you can be for your baby, whether you are a mum or a dad or a significant caregiver, is to be real, to be authentic, to be able to demonstrate to a baby, to an inquiring mind, that there is a range of emotions, that people have good days and bad days, and that you try your best. Babies don't need for mums to be super mums. Babies just need for their care to be mostly good enough, to be responsive, to be attuned, to be empathic. And while we may read this and it may seem instinctively to make sense, very often we are placed in situations where we find ourselves as new mothers, as new fathers, faced with a transition that is not just complex, but moving from being a singleton to a parent. And that often involves a transition that is neglected in terms of the ambivalence, in terms of the new responsibilities, the fears, the uncertainty. So how do you make sure that you're being good enough or that you're doing a reasonable job? The first thing I would suggest is to stop taking online surveys. 10 things that make me the best mother around. I would also suggest that you stop comparing yourself to other mothers. In fact, one of the worst things we have is mummy guilt. Mummy guilt by other moms who've done it better, who have better ideas, who have children who are better than the rest. And we need to be able to move away from this reliance of constant praise, of constant need for instant gratification. We need to be able to teach babies from a very young age that it is okay to just be happy, to be able to be joyful in the presence of others, to be kind, to be sensitive. And as a mother, and I use that term interchangeably with a caregiver, as a mother, one of the very first things that you can do to represent this to your child is to take care of your own mental health. Often a neglected part of mothering is maternal mental health. Mums very often suffer from baby blues, and it's brushed off as a normal occurrence. Oh, that's what happens. It's overwhelming. You need to cope. But what we are recognizing is that there are high rates of undiagnosed maternal postpartum depression, anxiety in both the mums and the dads. And if we're faced in a situation where we are living in urban areas, where we're far away from the support of extended communities, of grandmothers, of experienced aunts, of people who are able to tell us, it's okay, that's what happens. Everybody goes through that. We are less likely to be able to take care of ourselves. If we're less likely to take care of ourselves, we're more likely to go undiagnosed. If you are undiagnosed and if you are suffering with a postpartum depression, a postpartum anxiety, or something more significant, you are less likely to be responsive to babies. You are more likely to be intrusive. You are less likely to be able to reflect on what the baby's needs are at an adequate and appropriate time. It often is also perceived by others that accepting that you are unable to cope, that it is overwhelming, that your own mental state is struggling, as a sign of weakness. Babies need to recognize that adults also get sick, that adults also need to ask for help, and that adults need to rely on other adults. And why is this important? Because babies then learn that it's okay to rely on others, it's okay to ask for help, and it's okay to not be well 100% of the time. And this doesn't mean that we don't aim for a complete physical and mental well-being and health. It basically means that we are able to recognize, not only in ourselves, but in our peers, in our children, and in our partners, when mental illness or issues with mental health become a struggle and influence us. So if we go back to what makes a good enough parent, a good enough parent is a parent who is reliable, who is responsible, who is consistent. But a good enough parent is also one who is able to self-reflect, to be mindful. We mean quite simply to be present, to be in the moment, to be able to reflect on yourself, on your situation, and your reaction to that situation. And that's really important, because if we are mindful and we are present in the moment, we are true to what the feelings are in that moment. A good example of that would be if we're having a bad day, if you're feeling upset about something that has happened, and a baby says, "Are you okay, Mummy?" The right thing to do would be to be mindful and say, "Mommy's not feeling so good today. Maybe I just need a minute." Be able to compose yourself, to self-regulate. The wrong thing to be would be with your eyes full of tears to say, "Oh, I'm fine, it's just a wonderful thing," because you don't want your baby to be able to recognize the emotion. And that speaks against the principle of mindfulness, where we need to first do no harm to ourselves. And part of being true to yourself and being authentic to yourself is to recognize when you need to self-regulate. And that very example in self-regulation in an adult provides a good sounding board for self-regulation in babies and how they're able to adapt to stressful or overwhelming situations.